Good afternoon, everybody. This is Sarah Johnson. Dr. Swaim and I are going to be presenting today about Medicare wellness exams. You all should be able to see my screen now. Just a few housekeeping items. I do have everyone muted at the moment to cut down on background noise. We will have a time for questions at the end, so you can hold your questions and we'll open everyone's microphones at that time. And you can also, there's a chat box down in the bottom right. If you think of a question and want to type it in there, we'll address those at the end as well. But to go ahead and get started here, the purpose of today's webinar was really to give an overview of the wellness exams. For every type of traditional Medicare and our Medicare Advantage plans, each of them require a wellness exam annually, and they have a few different requirements depending on the plan, so that was the purpose of today's call. We will not be discussing compensation today due to we have a very a wide variation of people attending the conference or listening in. It does fall in line with the previous arrangements as far as our wellness and HealthSpring reimbursement, the way that the compensation and billing goes. So the first thing we're going to talk about are the traditional Medicare exams. The first thing to take note of on this exam is that the traditional Medicare exam is not a physical exam, and whenever we are scheduling these for patients, we are trying to communicate this to them. There's also an on hold spot on our phone system that communicates this is a comprehensive review of your health and wellness and preventive and chronic disease, looking at immunizations, screenings they might be eligible for. This is not a physical exam. It can, however, be done with a office visit and a physical exam. We'll touch on that in just a minute. The biggest thing to remember with this one is that you have to wait a full calendar year from the previous exam. It's got to be an entire 12 months. Whenever we're doing these, you go, you do your office note as usual, and you pull in the HPI form. Here I've got these listed depending on which exam it is. The GO402, the Welcome to Medicare, is done in the first 12 months of Medicare. GO438 is the initial annual wellness visit, so that would be their second year of Medicare, and then the GO439 is the subsequent. So all years after that, that's the template and the code that you would bill. Those templates are almost exactly the same, and if you complete the entire HPI form, you should have everything covered that goes along with that visit. Whenever you're working with these exams, you assess the diagnosis code. The 00.00 is the ICD-10 code. The previous code would be the B70.0, the health maintenance. And you also want to list all the other diagnoses if combining with an office visit. You will bill the appropriate Medicare annual wellness code in one of the 3G codes, and reception is working. Lila's working on a process to get each of these displayed on the daily schedule. We've been kind of piloted this with the group of primary care, and the way this works is when a patient comes in to see you, if they are eligible for one of these exams, you'll have that code listed in the comments on your all scripts schedule. So that patient may or may not have been coming for a wellness exam, but if you have the GO402 listed, you know that you can add that to the office visit you were doing for the patient that day. If the patient was having an office visit and a wellness exam, you would bill your E&M code and the wellness visit with the 25 modifier. And we do not, once these are complete, you have that complete HPI form as part of your note. You do not have to print this exam. We're done at that point with these. And this applies to all of our traditional Medicare patients.
So when you have your all scripts note pulled up, and this is just a test patient, under your HPI, right-clicking and selecting, you can add the form top or add the form bottom. On the traditional Medicare, and I've just added these in, you would choose either your Welcome to Medicare, your initial annual wellness, or your subsequent annual wellness, depending on which one of these the patient is due for, as Sarah was talking, and that should be prompted in the appointment notes. Each of these forms has the same information in it. It's basically just the coding. So your welcome to Medicare, your subsequent, and your initial. And so you just click on, you would click which one it is, then you could go to each of those little bullet points. You fill these out, and I won't go through every bullet point, but filling this out completely, and then when you get, after you have completed that, and as she said, you can do a E&M office visit as well. Under your assessment, you would assess whatever things you addressed in your E&M regular office visit, but you would also assess this health maintenance. And the health maintenance diagnosis is what you are going to link to when you're billing to your wellness code. There are also some templates under discussion and summary, and but those we'll talk about with the other two exams. But pretty much, even though it's contrary to its title, the Medicare Wellness does not necessarily include an exam. So if you address more than what these questionnaires show, then you can bill your office visit code, modifier 25, with your Medicare Wellness code. Okay, we have 3 different Medicare type patients. So that's the traditional Medicare, which is, if you've been doing those, there's really not a lot that's changed on that. For your health spring patients, again, this is an annual exam. For the health spring, you do not have to wait a full calendar year from the previous exam like you do with the Medicare Wellness. So you can do a Health Spring 360 exam starting now. Those can be done anytime during the calendar year 2016. This does include a physical exam. It also includes the Health Spring 360 exam under the HPI template. And you would complete the HPI form for the Health Spring 360 for 2016. This one, again, you would assess diagnosis of your health maintenance codes, and then we are not doing the HMRs for health yet because of ICD-10. So the 360 exam now is our communication with HealthSpring. So you can code this, what I still call V70.0 or Z00.00 as your health maintenance diagnosis, but then you can also code your other diagnosis to reflect the high specificity of your disease processes on these patients to communicate to HealthSpring a clear picture of this patient. We'll talk about the discussion summary form when we go to all scripts. With this, you will build preventative exam code based on their age. You cannot do a E&M code with the HealthSpring 360. So when you do the HealthSpring 360, that is the only thing included in this during that day's visit. If you do more, you just can't bill for that. When you have completed the 360 note, those need to be printed and then placed in your designated area for HealthSpring to pick those up. That process has not changed. So we'll look at, in our note here, under our HPI, we would not choose our Welcome to Medicare template this time, but we would choose our HealthSpring 360 template. Most of you are familiar with this. The 2016 has not changed from 2015 that I'm aware of. But you complete this form in its entirety. You can add other things under free text HPI if you want to. You would complete your past medical history, active problems, family social history. This does include a physical exam. Under assessment, you would choose your health maintenance. And then in addition to that, you could also choose any type of other diagnosis that they have in being sure that we're coding to the highest specificity. Under discussion summary, you can choose the HealthSpring 2016 template, and this, of course, we would not be having any HMRs now, but if you did any type of referrals, that could be addressed here. And again, these are printed after completion to be picked up with HealthSpring by the HealthSpring representative. So this is new. This is something that we have not done in the past, but our patients who have Blue Cross Blue Shield Medicare Advantage, these patients are now requiring a separate annual Medicare wellness. Like HealthSpring, you do not have to wait a full calendar year from the previous exam for the Blue Cross Blue Shield exam. It's in the calendar year, once a year. The HPI form, you will see Blue Cross Blue Shield Medicare Wellness. This is very similar to our HealthSpring 360, so it is more comprehensive. This does include a physical exam. In the chief complaint, it must say the patient's here for a wellness exam. Again, you would diagnose your health maintenance diagnosis, and like HealthSpring, you would also assess any other diagnosis that this patient has to reflect your highest specificity. Again, there's a discussion summary form that you can complete. The billing is different. Billing for Blue Cross Blue Shield Medicare Advantage, you will code your appropriate Medicare annual wellness code, your G codes, the welcome, initial, or subsequent G codes. And you will also code an additional 99420. Now, this again will be reflected in the notes for your office visit of which Medicare wellness you should choose, which G code, and we're going to have an additional, it'll either say 99420 or Blue Cross Blue Shield, so that you will be prompted to know that this patient needs more than just the Medicare annual wellness. Another difference with Blue Cross Blue Shield is that you can do this in conjunction with an office visit. So theoretically, if a patient were seen for a diabetic checkup, you saw they needed their Blue Cross Blue Shield wellness exam, you could charge your E&M code, modifier 25, with your G code and this 99420 code. So similar to HealthSpring in this regard, more like Medicare Wellness in the billing. These will need to be printed, and they can be sent to the North Clinic, and it can say Blue Cross Blue Shield Care Coordinator. So you can print these, send them once a week, or send them as you do them, but it's important that they get to the care coordinator. Now, if we go back and look at our note, under your HPI, you would choose the Blue Cross Blue Shield Medicare Wellness form. You can see it is very similar, if not, there's just a slight difference in that you may not even notice, but there's a slight difference in the fall risk screening to meet their standards. But for the most part, this is like our HealthSpring 360 exam that you're used to completing. Again, assessment, your health maintenance code, any other diagnosis to reflect the patient's illnesses, and then if you so choose, under discussion summary, you can complete this if you will be doing any referrals. I'm going to show you on our billing, when you're doing your billing, under your visit charges, so let's go over that. So for your traditional Medicare wellness, Many times you will have your established patient visit. Let's say we did a level 3. We're going to do a modifier 25, and then under preventative Medicare, we can choose our G code, our initial annual wellness, subsequent annual wellness. So those will be there for us to choose with your office visit code.
And they made that change today, so everyone should see that reflected today. You might have to log out and log back into Allscripts to see that change.
For your health spring, you will be coding one of your preventative maintenance exams. So either new patient preventative maintenance or established preventative maintenance based on their age. So you would choose, let's see, we would just charge our preventative maintenance exam for Health Spring. Now for our Blue Cross Blue Shield, say we potentially could have an office visit code with a modifier 25. Then you would choose your appropriate annual Medicare wellness code, your G code, and then there should be an additional, once this is updated, the 99240 choose as well. Again, you do not have to, shouldn't have to investigate that. It should be in the notes on the appointment schedule as to which codes to choose. Now, you don't have to do this in conjunction with an office visit. So if you just did the Blue Cross Blue Shield Medicare Wellness, then you would have your G code and your 99240 without the office visit code.
What we have found with the Medicare, traditional Medicare, and we kind of anticipate, although we're going to be proactive in scheduling HealthSpring and Blue Cross, because the goal with both of those is to get them completed in the first quarter of the year. The sooner we get those completed, that reflects our risk scores for those populations for the next calendar year. So that completion in the first quarter is very important, along with the specificity of the diagnoses. And that's also where, when you use the CQS dashboard, it will help you identify diagnosis codes that have not been captured or that we need to make sure we're billing. The Medicare Wellness, you will see those codes reflected on your schedule like you do for Blue Cross. The reason we are not doing those in the first quarter is obviously because those are on a rolling 12 months. You can't do them any sooner than 12 months. So that's one of the reasons. Those will be spread out throughout the year. Blue Cross and HealthSpring will be a quarter one focus. I'm going to hit a few, touch on a few reminder points as far as wellness exams in general. A lot of times we will see that respirations are not documented. That is very important for the wellness exams. Some of the requirements might have changed since you did Medicare annual wellness exams for traditional Medicare. Over the past several years, we have not done a whole lot of these. If you have any questions when you look at that HPI form, we have an RN, Donna Latham, who works with these and helps complete the exams, and we can set a time for her to come talk to you and review all of the requirements included in that form. I'm more than happy to sit down and try to send you some information for that. If wellness exams are not shown on your daily schedule at this point, they should be in the near future, hopefully within the next week or so. We're working on a plan to make those show for each provider. Again, wellness exams are done for everybody, traditional Medicare and all Medicare Advantage. We're going to send out, try to make a one-page graph that shows each of the different plans, the frequency at which it can be completed, what's included, the codes to bill, and what to do with that once it is complete. That way everybody will have a one-glance sheet to know this is what I do with these wellness exams. The G codes that we have listed, the G0402, 38, and 39, are all very important because Medicare needs those billed in sequence. That's why we're placing those on the schedule for you. And if you have a patient that you think might qualify for one and the code is not on your schedule, if you'll ask, the first person to ask might be reception immediately, and then they can call if Lila or someone and help figure that out. So if you think someone's eligible and there's not a code on your schedule, we can help figure that out for you and tell you which code to bill, because the specific code is very important, making sure that we bill that to Medicare in the right order. Dr. Swaim, do you have anything else at the moment?
The only other thing is just to make sure that if you do not want to complete these for your patients, please let us know, because we can get these. If you don't want to do the Medicare Wellness, we do have nurses and some other mid-level providers that are doing these, and we need to know so we can get these completed. They are very important that we get those done in a good time frame.